It's 1973. We're in Columbia, Tennessee, south of Nashville at Central High School. I'm a junior that year, and I signed up in the spring for a sociology class taught by a Vietnam veteran who had just returned from the war. He asked us to read a book called Future Shock by Alvin Toffler. It had a shocking pink cover on the paperback version with Future Shock written in large letters. I thought it sounded kind of interesting. Maybe it was science fiction. He said in that book that eventually we would all be in a constant state of unplanned and planned change all at the same time, and that it would be completely overwhelming, completely saturating every living moment, and we would experience a kind of future shock. So much change would be happening so quickly. Well, here we are, of course, 50 years later, more than 50 years later, and we are experiencing unending change. We're in constant upheaval, constant pressure. I'm Mark Medlin. I'm a healthcare leadership advisor and the founder of Stability Edge. My forthcoming book, The Stability Architect, is about how senior healthcare leaders sustain operational coherence under continuous pressure. I'd like to tell you what I've witnessed through the years working in health systems, and I'd like to tell you what I'm wanting to do about it now.
On paper, we are winning. The large monitor clearly shows the charts for our new ambient clinical documentation technology. The curves are all green, trending upward, and labeled ahead of target. This is exactly what the board wants to see. The implementation is technically flawless. Outside the window, my flagship hospital of our system, 9 hospitals, 20,000 employees, looks calm. But as I stand there, I don't feel successful. My gut tells me these metrics are hiding something. The silence in my own office feels heavy. Next came our weekly executive committee meeting. In a health system this large, robust debate is our oxygen. We rely on leaders who challenge assumptions, particularly the seasoned physicians. But as I look across the polished boardroom table, I see only passivity. The man I'm watching used to be our fiercest challenger. Now, he's silent, his head bowed over clasped hands, staring at the table while a generic system improvement update presentation plays. He hasn't spoken in weeks. His silence is deafening. It's not agreement, it's disengagement. I needed a pulse check, so I went to the floor to see a nursing director I've trusted for a decade. We met near a busy station. I needed the truth. Our conversation was quiet, contrasting sharply with the loud efficiency of the surrounding unit. When I asked how she was really doing, she didn't complain. She just looked away and gently told me she was quietly planning her next chapter. Her exhaustion wasn't physical, it was structural. When the keepers of the culture start quietly leaving, you know the center is failing. The evidence of a stalled system isn't always vocal. Sometimes it's just inertia. Late that night, long after the C-suite was empty, I was still in my office, illuminated only by my screen. I was tracking a specific escalation, a critical operational bottleneck that needed a decision in 3 days to maintain flow. The screen showed me the reality of our cultural silence, a digital visualization of bureaucratic paralysis. I imagine a prominent red stamp confirmed the status. Pending 3 months. We are moving system improvement plans forward, but we cannot solve a single 3-day issue. We are trapped in a loop, and no one is fighting the process. The next evening, I step out of the office and the noise, onto an upper concrete observation deck. The organization feels empty. Nobody is openly resisting, but nobody is building either. Standing here, small against this vast, silent grid, I am forced to confront what my gut already knew. When the standard alarms, resistance, noise, debate, are gone, the silence itself is the final alarm. The center is no longer holding.
In most American health systems today, the smartest people in the building are running on operational structures that were inherited from an earlier era. Structures designed for steady state conditions in a system that no longer has a steady state. EHR transitions, AI deployments, workforce shortages, financial pressure, regulatory churn, mergers, payer disruption, ransomware threats. These no longer arrive as isolated events between recovery periods. They overlap, compound, and rarely resolve before the next wave arrives. And yet the executive committees, governance structures, escalation pathways, and change management systems that healthcare leaders are using to absorb all of that were designed for the world of episodic disruption. They were built for occasional weather. These structures are now being asked to hold during permanent storms. You see the result. The dashboards stay green, the committees keep meeting, the improvement plans keep advancing, and underneath the surface, the organization drifts. Decisions stop closing. High signal escalations get lost in the noise. The strongest physician leaders and nursing directors quietly disengage. And the leaders running those organizations, some of the most capable people working in the United States, are running as hard as they can and arriving everywhere late. What I've learned over 35 years is that the people are not the problem. The architecture that we work within is the problem. Extraordinary people break inside weak architecture long before they stop caring. And weak architecture is what most American health systems are quietly running today. The good news, and it is good news, is that architecture can be redesigned. I've spent the last several years building a doctrine for that work, 6 structural elements paired with 6 leadership skills, anchored in a foundation of psychological safety, drawn directly from Deming and from Amy Edmondson's research on high-performing teams, among other thinkers who are important to me. It's the framework I now use full-time in my work with the executives who are interested in redesigning how their organization holds together under continuous pressure. If you're a healthcare executive carrying weight none of the existing frameworks help you carry, if you're looking for someone to speak at a conference, executive retreat, or a board meeting about what holds organizations together when the conditions don't ever let up, I would welcome the conversation. I also invite you to visit my website, stabilityedge.com, or to give me a call. I'm going to put the number in the description below. Thank you very much for watching.